Hey guys, this is Dr. John here. Dr. Dave's going to be joining us here right now. But with that, we just wanted to take a little bit of time and start addressing questions that are commonly asked to us in the bays, in the adjustment bays, or here in the office, or even on their first appointment.
Yeah. So common patient questions, and one of those common patient questions revolves around massage therapy.
Right.
So we've had this question often asked from a couple of different versions of it, but essentially, is massage therapy going to help me with my problem?
Right.
So whether that be upper back pain, shoulder tension, low back pain, a lot of the common problems that we're taking care of you guys for, how's another way that might be framed?
Can massage therapy help me? Is massage therapy better for me to get than chiropractic care, or should chiropractic care better than massage?
Yeah, and then the other question we always get too is it better for me to do my massage first or my adjustment first?
Right.
So let's tackle the first one. So is massage therapy beneficial to help me with my neck pain, upper back pain, lower back pain, or the chief complaint that you are looking for help with?
Yeah, simple answer, yes, most definitely.
Now why?
And as we look at the body, and specifically the spine, these little areas that poke out, you have every single one of them has muscles attached to them. Not to mention on different areas of each vertebra. But with that said, when some area in the neck, low back, mid back starts to get tight, right? And what is getting tight? The muscles. It starts to pull on these bones, and it can literally turn and torque them and create even nerve pain.
So from a structure standpoint, you're saying that much of the complication that we take care of patients for here in the clinic, from a chiropractic standpoint, is a structure problem where the bones pull out of alignment.
Correct.
Chiropractic care is going to be very beneficial for addressing the smaller support muscles that keep your bones aligned. Now for the bigger muscles, like larger, bigger shoulder muscles, what are these guys called down here?
Your paraspinal muscles.
Yep, and your lumbar extensors, and your quadratus lumborum. It's like this big square muscle right here. You have larger muscle groups in your body that support your spine, but they're not directly altered from the chiropractic adjustment. So it's often that in supporting your spine in the misaligned or poor structure that you originally came in to see us for help with, your body ended up having chronic muscle spasms, right?
Right.
Where the muscle's over tight and burdened and stressed, and because it's getting overworked continually on a day in, day out basis, what does it build up?
Scar tissue.
Right, and then also lactic acid, right? So that's where you start getting some of the massage therapy work, and you get that tender spot in the muscle, or even when we're adjusting you guys, sometimes we'll be kind of pushing and doing some what's called motion palpation to see how the joint moves. We might hit on a certain muscle and it's super tender spot. That's actually a buildup of lactic acid. It's called a trigger point.
Yep.
Because the muscle is chronically spasmed. So massage therapy is going to address that part of it, relaxing larger muscle groups.
And we look at any sort of thing from posture to even being like right-handed or left-handed. So if you're right-handed, typically your left pectoral muscle is going to be bigger than your right, because your left pectoral muscle has to support when you use and carry things on your left side. So naturally, just by doing normal things in everyday life, certain muscle groups will get tighter or worked more that need to be released. Right. And when that goes to what we do as far as chiropractic care, if we go in and we make the adjustment, and we don't address the muscles that are overly tight, what's going to happen to that bone but get pulled exactly back to where it was.
Right.
So not only do we want to get it aligned back to where you should be, but we also want those muscles to relax, forget that muscle memory that it has of being overly tight, so that it can stay where it was.
So basically we need to work with the structure to realign the bones, and then after realigning the bones, the vibration platform that you might be on right now watching this video, that's essentially going to get the smaller posture support muscles in between your bones, the ones that are responsible for like structure and keeping the bones together, it's going to get those improving. But the bigger muscles, that's where the massage therapy comes in. And the synergistic effect of working both of those, the structure, the support muscles, and then the big muscles with massage therapy, is where it all kind of fits together like a hand in a glove. That's why for a lot of our newer patients, we've been including massage therapy in your recommendations. If you're an established patient that's been here for a lot longer, you might not have done massage therapy yet. So we would encourage you, if you haven't done massage therapy, or you've already been doing massage therapy but you haven't done it in the past 30 days, to maybe revisit that.
Right.
Schedule, book an appointment, check out our licensed massage therapist, Josh, and see if you can get on his schedule so that you can get a little bit of release from all that muscle tension. Massage therapy for you,
Saved my shoulder, saved me from having surgery.
because Dr. John chronically, well, I shouldn't say chronically, consistently over and over and over again, we do repetition in our work, and it's a lot of demand on our body. So like I mess up my wrist adjusting from repetition, doing side adjusting on the hips. Dr. John was hurting his shoulder.
Yeah, I woke up one morning, put shampoo in my hair or on my hand, and then went to put up in my hair, and I couldn't raise my shoulder. It's called adhesive capsulitis, frozen shoulder.
Yep.
Literally couldn't move my arm more than about 10 degrees any direction.
And that's not good when you're a chiropractor.
No, kind of need that. So it turns out I tore my labrum, and I didn't want to get surgery because that would put me out of adjusting and helping you guys. So I talked with Josh about it, and you know, it wasn't a comfortable experience. And as you guys know who have been on Josh's table, he digs deep and he gets these things to relax in a way where I have, you know, full functioning ranges of motion with my shoulder without going underneath, you know, the scalpel. And
you're not taking any pain meds,
right,
muscle relaxers,
Which-
anything crazy.
yeah.
So you're able to help your body heal it naturally by addressing the soft tissue and the muscle component the right way.
right.
So
For
it's
sure.
awesome. That's such a cool testimony for Dr. John, even how massage therapy helped save his shoulder.
Yeah.
So now he can continue helping you guys. So anyway, that was the first question. We'll do another question here in an upcoming video, but we hope that obviously this is helpful for you guys. If you have content, more information that you want to learn specifically about, ask that question at the front desk. So bring it to the front desk, let our team know that you want the doctors to talk more about this or that, and we'll make sure that we start curating content that's a little bit more specific to those requests. Either way, keep vibing out, keep getting adjusted, and we'll see you guys soon.
All right, bye guys.
Good one.